Hereditary Hemorrhagic Telangiectasia (HHT). Hereditary Hemorrhagic Telangiectasia (HHT) is a genetic disorder of the blood vessels that can occur in the brain, lungs, digestive system, skin, or other organs. What is hereditary hemorrhagic telangiectasia? HHT is a genetic condition that causes enlargements and tangles of veins and arteries, telangiectasias, and other malformations of the blood vessels. These can occur in the brain, lungs, digestive system, skin, or other organs. HHT is somewhat rare, affecting approximately 1 in 5,000 people. It does not occur more frequently among people of any gender or racial or ethnic background. More than a century after being discovered, HHT remains poorly understood and challenging to diagnose. Although an estimated 95% of people with HHT experience symptoms in their lifetimes, the symptoms of HHT can look like those of other, more common causes. As a result, people with HHT often live with the condition for years, even decades, before receiving an accurate diagnosis, and complications can occur. For example, bleeding episodes associated with HHT can lead to life-threatening blood loss or damage to internal organs, such as the brain. Telangiectasia definition. Telangiectasias are a type of arteriovenous malformation, AVM. They are small, dilated blood vessels that occur close to the surface of skin or mucous membranes. Not all telangiectasias are cause for concern. For example, spider veins that appear beneath the skin or the reddened areas of rosacea on the face are common forms of telangiectasias, and these seldom cause severe bleeding. However, some types of telangiectasias are signs of diseases and syndromes such as HHT. Blood vessel malformations in the spine, lungs, and brain may require intervention to avoid rupture and bleeding. Types of HHT. Hereditary hemorrhagic telangiectasia can be caused by 2 different genetic mutations. 1 HHT caused by a mutation in the ENG gene, and 2 HHT caused by an ALK-1 genetic mutation have similar symptoms but different genetic causes. Ongoing research into the disorder may reveal other mutations and types of HHT. HHT symptoms. The main symptoms of hereditary hemorrhagic telangiectasia involve blood vessel malformations that can cause bleeding. Telangiectasias and other AVMs in people with HHT can form from birth until adulthood and may occur in several organs of the body. Nose. Nosebleeds are a common symptom of HHT and can be spontaneous without an obvious cause and recurring. Some can be heavy enough to require medical interventions, such as blood transfusions. Skin. Telangiectasias can emerge on the skin or inside the mouth, especially once the person with HHT reaches the age of 40. The telangiectasias may look like spider veins or tiny red or purple spots that turn pale or white. Brain. Bleeding in the brain can cause headaches or seizures. Rarely, the rupture of an aneurysm or other vascular malformation can lead to severe, life-threatening brain bleeding. Although this only occurs in about 2% to 3% of HHT patients, people with HHT are more likely to develop brain AVMs and are at increased risk of rupture as a result. Lungs. Pulmonary arteriovenous malformations (PAVMs) in the lungs can cause headaches, fatigue, and exercise intolerance due to shortness of breath. PAVMs can cause blood clots that can travel to the brain and result in a stroke. PAVMs in a person with HHT1 can rupture when their body's blood volume increases, such as during pregnancy. Digestive system. AVMs in the gastrointestinal tract are found in 80% of people with HHT. These usually do not cause bleeding and can occur in the esophagus, the passageway from the mouth to the stomach, or the intestines. When they do bleed about 15% of the time, they can cause black stools, feces, and anemia can result, leading to concerns of cancer and other disorders. Liver. When an AVM occurs in the liver, it can slow blood flow through the body. The heart must work harder to push blood through the tangled vessel malformations. Over the years, this extra stress can cause heart failure. Spine. AVMs in the spine are rare in HHT and occur in only about 1% of people with the disorder. Numbness, difficulty moving, and swelling in the back or upper legs are some of the symptoms that can be caused by a bleeding. Spinal AVM. What causes hereditary Hemorrhagic telangiectasia is a genetic condition. A mutation change in just one gene is enough to cause HHT. If one of your parents has the disease, you have a 50% chance of having it as well. How is diagnosed? Doctors diagnose hereditary hemorrhagic telangiectasia when 3 or 4 of the following conditions are present in the patient. If 2 are present, HHT is suspected but not confirmed. Recurring, spontaneous nosebleeds. Telangiectasia's red spots visible on the skin that turn pale when pressed. Malformed blood vessels in one or more internal organs, such as the lungs, spine, or brain. A family history of hereditary hemorrhagic telangiectasia HHT diagnosed in a sibling, parent, or child. Genetic testing for HHT. A positive genetic test can confirm HHT. However, negative genetic test results do not always mean the disorder is not present. Several gene mutations can cause the types of blood vessel problems that occur in HHT, and not all of these are known. Some people with HHT may have a genetic pattern that is not yet identified. People with persistent signs of the condition should consider repeat genetic testing, as these tests become more sensitive and look for additional gene mutations that can cause HHT. Genetic testing can also help prospective parents understand the risks of passing the disease to their children.